So you all have a copy of this study guide to the inflammatory response in massage. And I'm going to go over it briefly because I want you to use it for the discussion board assignment this week and really sort of try to think about the inflammatory response and the stages of the inflammatory response with regard to a specific injury or an injury either you or someone you know has experienced, and then how it was treated. So it's 2 pages. This page talks about the cardinal signs and the biological activity in the body during the particular stages, what passive range of motion is going to be like in those individual stages. And then the second page talks about treatment goals for the individual stages and then what our treatment plan might be. So we'll talk about individual soft tissue mobilization techniques that you might use in the acute stage or the subacute stage or the return to function stage. So we talked about this in the last module. In the acute stage, or it's where you have your full inflammatory response, the cardinal signs are swelling, redness, heat, pain, and loss of function. In the subacute stage, where we're healing more, it's the granulation stage. The cardinal signs are going to be the same as the acute stage, but with diminished intensity. So you're still going to have some swelling. You're still going to have some redness, heat, probably pain, but less pain, and less loss of function as well. Within the chronic or the return to function stage, which is the remodeling and maturation stage, you're not going to have any of the cardinal signs. So the biological activity that's going on during the acute stage are local changes in vascular flow and capillaries, and that's what's causing our swelling and redness and heat. We're going to have transient vasoconstriction to isolate the area, followed by vasodilation, slowing of circulation and congestion or stagnation. And I talked a little bit in the soft tissue lecture about how we're kind of dealing with tissue congestion and stagnation. And that has a little bit to do with the loss of function, and then changes in vascular permeability leading to the edema or swelling. So in the subacute stage, in the biological activity, the inflammation decreases. We're getting resolution and repair of the injured site beginning. So we're getting the migration of cells to cover the site. We're getting granulation tissue forming. Noxious stimuli are removed. So we're not getting as many of the chemical messengers that are irritating those C fibers and those A delta fibers. So that's where the diminished pain comes in. We're getting neovascularization, the growth of capillary beds, and so the granulation tissue looks pink. Fibroblastic activity is starting to begin, collagen production and formation. And remember, it's that type 3 collagen, that weaker type collagen initially, and granulation tissue develops. The connective tissue is immature and fragile. So that type 3 collagen is just more fragile than the type 1 collagen, which will eventually replace it. And adhesions begin to form. So the adhesions are where the scar tissue is stuck to the tissue around it. So that's all happening in that initial healing stage. In the remodeling and maturation stage, we're getting remodeling and maturation of the scar tissue, where the type 3 collagen is being replaced with type 1 collagen. The scar tissue is maturing. The fibrocytes are maturing. And the collagen and connective tissues are maturing. The collagen becomes reoriented along the lines of stress. So that's where we want good scar tissue mobilization, soft tissue mobilization, and functional exercise. So the collagen becomes oriented in a functional scar. The scar tissue is going to shrink, and adhesions may form with the surrounding tissue if it's not prevented. And the way we're going to prevent it is with soft tissue mobilization, scar mobilization, and functional exercise. So with passive range of motion results in the acute stage, you're going to have pain early in the range of motion. And that makes sense because everything's all worked up, everything's stirred up. And you might have muscle guarding and spasms that limit range of motion as well. In the subacute stage, you're going to have pain at and tissue resistance near the end of the range of motion. So in the acute stage, it could be like right away, as soon as you start to move it, ow, that's painful. In the subacute stage, you're going to have resistance to movement and pain near the end of the range of motion. And a lot of times during the subacute stage, we're working on increasing that range of motion. In the return to function / chronic / remodeling and maturation stage, we're going to have pain beyond the end range with a stretch. So you say, okay, pretty good range of motion, but you try to move beyond that into a stretch and there is still some pain. Adhesions might limit your range of motion. You might have full range of motion, but the strength is not fully returned. And so there's some loss of function still present. And so that's where we want to begin our restoration of function. So when we start now talking about treatment goals for those 3 different things, the treatment goals in the acute stage, we want to decrease pain. We want to decrease, and in order to decrease pain, we want to decrease edema and muscle spasm. We also want to do that in the subacute stage, in the healing. When we're into the chronic / return to function stage, we want to decrease pain from adhesion or contractures. So we want to restore the normal function. So our pain in that stage might be coming from adhesions or contractures. In the acute stage, we also want to maintain available mobility within limits of pain. So we don't want to lose any mobility. We want to maintain function of associated areas. So say someone has had a rotator cuff repair in their shoulder. You want to, even in the acute stage, when you're restricted from moving that shoulder very much, you still want to move the elbow and the wrist and the hand to make sure we don't lose any function in those areas. And we want to stimulate circulation in that injured area. So by working the distal areas, we can stimulate circulation. In the subacute stage, we're going to still work on decreasing pain and edema. We want to increase soft tissue mobility, align the scar tissue, and strengthen supporting or related muscles. So we might not be strengthening that particular area as of yet, but we are strengthening supporting or related muscles. In the chronic or return to function stage, we're decreasing pain from adhesion or contracture. We're still working on increasing soft tissue mobility. We want to strengthen the affected areas and their related structures, not just the supporting areas. And we want to work on returning to normal function. So we're going to be doing a lot of functional activities. So the treatment plan for the acute stage, ice packs, ice in any form, ice baths, ice packs, cold compresses, ice massage, and that's all to decrease pain and edema and spasm. Elevation, compression, rest. So the ice goes with the elevation, compression, and rest. Those are all important for reducing pain, edema, and spasm. We want to do passive range of motion within the limits of pain. So we want to keep the area moving, but we want to let the patient's pain be our limitation. It mentions some different massage techniques. Strain, counter strain is one, which you will learn. Swedish massage in the non-involved areas, and that's for increasing circulation. And you'll learn some of that in lab as well. Active range of motion for surrounding and opposite structures. So I always say to people when I'm working with them post-surgically, I say, don't forget to work the other side, because the left side can learn from the right side. So doing those opposite structures is important too, active range of motion. So that's the patient moving it themselves. And even massaging the opposite side of the body to stimulate circulation. We often don't do that in physical therapy, but it is definitely something that you could do. A lot of times if you're working on lymphatic drainage, you are working on the opposite side of the body. So when we have our guest lecture about lymphedema treatment, you'll hear a little bit more about that. So the treatment plan for the subacute stage, the healing stage, we're still doing ice. Ice is your friend. You're still doing ice even in the return to function stage. So I just keep a bunch of ice packs in my freezer because you never know when you're going to need it. You can use heat and cold in combination for a vascular flush. So I put here cold, hot, cold, hot, cold, hot. So you start with cold, you end with cold. So cold does vasoconstriction, and then you get heat and it brings circulation back to the area, and then you do cold and it pushes it out, and then you do heat and it brings it back in. So you're basically flushing the area of the stagnant fluid that's in there and getting fresh new fluid in there. Lymphatic drainage is a massage technique that we can do. Strain, counter strain again. Swedish massage again, which is long strokes. Long muscle strokes. Muscle energy technique, which is a technique for aligning your different structures in your body, and you will learn something of that in your manual therapy class next year. And cryokinetics, which we'll do some of in the second lab this quarter, where you're applying ice and stretching at the same time, or heat, but most of the time it's ice. Cross fiber friction massage increases circulation to the area. We want to do that. Isometric exercise, you're strengthening the muscles without actually moving the injured part. And then isometrics move into progressive resistance exercise. And in terms of the individual exercises, you're going to learn a lot more of therapeutic exercise in your orthopedic courses next year. In the treatment plan for the return to function stage, we're still doing ice. We're still in cryokinetics. Petrissage and deep tissue are two techniques that you're using to decongest the tissues, lymphatic drainage as well. Stress point or trigger point, you will learn some of that in this upcoming lab. Muscle energy technique again. Cross fiber friction on adhesions or scar tissue. And you might be doing that with instrument-assisted soft tissue mobilization, which you will learn more about in your manual therapy class. Active range of motion, that's the patient moving on their own. Isotonic progressive resistance exercise. So now we're really starting to get into strengthening. And then functional activities, and you might even add a component of resistance to those functional activities. So you can see how your treatment is going to progress from sort of a more passive treatment into a more active treatment. So we're often using modalities in a passive treatment, but as the stages of healing progress, we are going to move to more active treatments. So I hope that helps you sort of get the idea of how the individual treatment goals change during the inflammation and healing process.